What is ADHD? ADHD is an acronym that stands for Attention Deficit Hyperactivity Disorder. It is often described as disorganized, forgetful, and impulsive. These are just a few of the words used to describe ADHD. ADHD has always been around, but it was first officially recorded in the early 1900s through a poem. Back in 20th century America, less than 5% of school-aged children were diagnosed with ADHD. However, since then it has almost multiplied to above 11%. In America, an ADHD epidemic has begun. In every region of the United States, we have seen growth. Especially on the East Coast, numbers are at its highest, the highest being at the Southeast at 11.8%. Statistics point out in America that 6.1% of American children are being treated for ADHD with medication, and there has been a 42% increase in attention deficit hyperactivity disorder over the past 8 years. What issues could be causing this mass growth in labeling in America, and what arguments surround this epidemic? Who is being targeted for attention deficit hyperactivity disorder? Psychologists Jessica Stevens and Dana Bird's research shows that 12% of children between the ages of 12 and 17 have been reported of receiving a diagnosis, where only 4.4% are diagnosed as adults. Children are being diagnosed more often because a lot of the natural characteristics for being a child are active and energetic, which can often get confused with the side effects of ADHD. Another group being targeted for diagnosis are males. Janice Sickelman did research as a nurse and noted that over half of her patients diagnosed with ADHD were male. In reality, they were not more prone to ADHD, but actually have different developmental behavioral patterns, which can look like ADHD compared to women. In this graph, it shows the percentage of children aged 5 to 17 years ever diagnosed with attention deficit hyperactivity disorder by sex, from 1998 to 2009. This displays such a good visual of a high percentage of males receiving diagnosis. Another issue surrounding America is ulterior motives. With the boom of social media, it could be contributing to the epidemic. A lot of companies in the ADHD market put out ads to start awareness to get tested. For example, in this advertisement, it states how adults with ADHD are 2 times more likely to have been divorced. At the bottom, it says the consequences could be serious, so screen for ADHD. On the other half, it goes on to talk about how depression and ADHD go hand in hand together. How does this help but create a negative impact of ADHD? People might think they have it or just want to prevent a divorce, resulting in testing and an increase of profit for the companies. The last major issue that arises when debating over the ADHD epidemic is who is responsible for giving out the diagnosis. Going back to Bird's research, she found that in a sample of over 3 million children with ADHD, it was found that 75% of them were diagnosed by a primary physician, then 12% by a psychiatrist, and 12% by a mental health specialist. The argument is that primary physicians should refer them to a specialist in the ADHD field so that they get a more accurate diagnosis. Are these arguments the real issue in America surrounding the epidemic? And if they were fixed, would the numbers go down? What is going on with ADHD around the rest of the world? Do countries have the same issues as America, or do they have other alternatives to fixing this epidemic? Is this a global problem, or does America have some lessons to learn? Here's a graph that shows the percentages of the countries that medicate children for having ADHD. Unlike the US, where medication is the common denominator for all the issues, some countries, for example France, Japan, and the UK, barely medicate at all. But how is this possible for the US to have so many people receive medications and causing all of these problems, where some countries don't even medicate at all? What are their other solutions, and how are they avoiding the medications? The one country that I found to have the most opposite approach to the US is France. In France, they almost do not medicate children at all. However, they have ulterior methods. When comparing the USA with France, the USA prescribes 66% of the ADHD kids with drugs. They use a more medicinal approach and put emphasis on biological and neurological research. When looking at France, they would rather look for social and domestic causes rather than medicate them with powerful mind-altering drugs. They think of it as problem behavior is looked at as the cause. Another big difference between the USA and France is that the USA has less emphasis on parenting skills, where the French parenting is more structured. Family counseling is the preferred treatment in France, and the whole family attends to make sure that their child has the best possible outcome. It is hard to believe that France is successful by not using medications and by counseling, but there is proof of this effectiveness. In this image, it shows how two subjects, one with ADHD and one without, go to counseling. In the first image, it shows how much stimulus is going on in their brains and how after each visit it goes down to almost having none of the extra stimulus. It shows that you do not need medication to reduce stimulus. This could be a good alternative for the US when trying to reduce their epidemic. I do not believe the US should turn to France's approach because it wouldn't really solve the issues at hand. From growing up with ADHD my whole entire life, I do believe that we could learn from France and be more precautious when giving out medication. However, I do not think taking away medication completely, like France, would be a good path. I have taken medication since middle school and it has helped me so much. I remember before I started the medication how hard it was to focus in a classroom and get my work done. But ever since I started it, I've been able to get my work done and be a better student. France's approach is a good one, and it's a good alternative to go to counseling instead of taking medication, but it does not always work, and it's not always accurate. This past year, I took educational psychology, and we studied ADHD in the classroom. One of the tasks was to take a test that shows what it's like to have ADHD in an online classroom. It shows the distractions and problems for children with ADHD and gives a good perspective to what is going on in their minds. Some people do not realize just how hard it is for them to focus. So here's the link to the test, and it will be copied in the credits. I encourage you to go take this test and see what it's like to be in their mind before people make assumptions about how to treat ADHD.